am Alexis Anderson, and I will be you guys' teacher for today. So, what is breast cancer? I'm sure you guys have all heard this word everywhere lately. But breast cancer is a type of cancer that starts in the breast, and it starts when a cell begins to grow out of control. They usually form a tumor, so it can be seen on x-rays or felt as a lump. Most of you probably think that breast cancer is entirely in women because we are obviously the ones that have the anatomy to get breast cancer. But surprisingly enough, men can get breast cancer as well. So, how common is breast cancer? Breast cancer is the most common cancer in American women. Across the board, state to state, it is the most common, except for skin cancers, but they don't really count skin cancers in the serious category that breast cancer can be. Most women have a risk of about 13% of developing breast cancer in their lifetime, which means 1 in 8 women have a chance that she'll develop it. So out of all of you, there's 16 of you here, 2 of you are going to get breast cancer in your lifetime. It's just, that's the risk that there is. So speaking of risk, we probably want to know what our risk factors are. Without looking at the board, can anybody tell me some of the risk factors that you have heard of or that you've had doctors tell you before we go over our risk factors? All right, I want to start with the lifestyle risk factors. So these are things that we can do that are changeable in our lives. So the first one is drinking alcohol. That is a risk factor. Second is being overweight and obese. To go along with that, it's not being physically active. That can increase your risk of breast cancer. The next one's a little hard, but that's not having children. I understand that everybody is different in their belief on having kids, or you can't have kids, but just realize that by not having kids, or if you can't have kids, that does increase your risk of breast cancer, and just to keep your eye on that. The next thing is not breastfeeding. I'm sure you guys have all heard your doctors encourage you to breastfeed, not only because it's good for your baby, but also because it does reduce your risk of breast cancer. The next one is another little controversial one when it comes to risks on breast cancer, and that's the use of oral contraceptives. The medical community and all of us understand that we need to prevent unwanted pregnancies, but just realize that the use of an oral contraceptive can increase your risk. It won't always increase your risk, but it can. The next one is the use of hormone replacement, mostly in women over the age of 55. So just kind of think about that after your menopausal years. The hormone replacement does increase your risk. The next one is more on the cosmetic side of life, is if you get breast implants, breast augmentations to increase your size, it does make it harder for them to detect tumors or anything within your actual tissue. So we have lifestyle changes. You guys all have a piece of paper and some pencils to write down notes, but I want you to look at your lifestyle, look at those lifestyle factors, and see if there's one that you can work on doing to lessen your chance of breast cancer, whether that be decreasing your alcohol intake, maybe becoming more physically active, maybe think about breastfeeding on your next baby if you're going to have one, and things like that. So I'll give you guys a little bit to think about that, and then we'll go from there. All right, now that you guys have figured out what you want to work on in your lifestyle, there are some factors that we can't change that just increase the risk of breast cancer. So the first one is being born female. It just happens. You have the anatomy. That's it. The second is aging. Breast cancer tends to be in older women more than it is in younger women, just because younger women are more active, they're having kids, they're in that phase of life. And the second one is family history. If you have a family or personal history of breast cancer, that does increase your risk, and that's something you can't really change. Also, race and ethnicity. Women who are Caucasian tend to have a higher risk than those that have a different race or ethnicity. Now, one that science can't quite explain why, but being taller. Women who are taller have a positive correlation to increasing breast cancer. They've done studies, but they just really don't know why. Another one is having dense breast tissue, and that's purely because they can't detect tumors as easily in women that have less dense breast tissue. And then starting menstruation early. If you start before the age of 12, you just have more of that hormone in your body that can increase the risk. And having a late menopause. If you have menopause after 55, then that also increases your risk. And if you guys have any questions about risk factors, lifestyle factors, I am happy to answer them either now, or if you rather ask me after the workshop, feel free to come up and talk. All right, so breast cancer is the second leading cause of death in women. And right now, it's estimated that in 2021, 43,600 women will die from breast cancer in the United States. That's a huge number. And on top of that, Idaho is second to the bottom in breast cancer screenings. That's like 49th out of 50 states. So what can we do about it? What can we as women do about these large numbers, scary numbers that come with breast cancer? Well, early detection. There are so many ways to detect breast cancer in its early stages. Are there any ways that you guys have either heard of or that you use that you can detect it? Those are great answers. Thank you, guys. So my first thing is I want you to know your signs and your symptoms. So there's lots of them, but this kind of picture here gives us a good idea. So pain. Constant pain that's not normal is a good sign. If your nipple starts to become inverted, sign. Rashes and discoloration that's not normal is a good sign. Changing of size or shape outside of pregnancy and menopause is a huge sign. Change in texture, a lump or thickening of it, swelling, and then another one is unusual discharge. So those are some of your basic signs. I will send out this little signs and symptoms chart in the back corner. We have it on a table for you guys to pick up and take with you. The first thing that every woman should do is call the self-breast check. This should happen on a regular basis, whether that's monthly, bi-monthly, weekly, it's up to you how often. But this is where you should be getting to know your body, getting to know how your breasts feel on a regular basis so that you can notice the differences. The next one is a mammogram. So this is a yearly screening that every woman 35 and older should be getting. It's an X-ray of the breast tissue to see if they can find any lumps, any tumors, any fuzzy bits in your screening. And this just allows them to detect it on an earlier basis as long as you're getting it done yearly. Very important to get it done yearly. And if you haven't scheduled it, we are getting towards the end of the year. So call up your OB and get that appointment because mammograms are so important. So we're gonna go back here to your know your signs and symptoms, and we have a little activity. So all of you should have a piece of fruit on your table. I want you to pick it up, look at it, and see if there's any of these signs and symptoms of breast cancer on your fruit. And then write them down, circle, you have a Sharpie there, circle the areas on your fruit, and then we'll talk about them. All right, guys, thank you so much for that activity and for coming to our workshop today. Like I said, in the back, there are some of these signs and symptoms pamphlets for you guys to go ahead and take. If you have any questions, feel free to come up and ask me.